Hi there! In this video, we will be looking at heart failure, specifically differentiating and discussing left and right heart failure. So what exactly is cardiac or heart failure? Well, it's defined as a clinical syndrome resulting from any structural or functional cardiac disorder that impairs the ability of the ventricles to fill or eject blood. As a result, the heart is unable to provide sufficient output to meet the body's demands. Cardiac failure is usually the final pathway of many heart diseases, and it can also be divided into right heart failure and left heart failure. First, let's look at right heart failure. So in right heart failure, there's usually a problem with the right ventricle. And as a result of this, there's a backlog of blood in all the organs and tissues that drain into the right heart. Because of this, the clinical presentation and symptoms often reflect the congestion of these organs and tissues. That's why some of the symptoms include bilateral pitting edema in the lower limbs, so it starts in your feet and progresses proximally towards the thigh with increased severity. Ascites, which is accumulation of fluid in the abdomen resulting in swelling. Hepatosplenomegaly, from the congestion of the liver and the spleen, and a raised jugular venous pressure. Your jugular venous pressure is a direct reflection of the pressure in the right atrium. In right heart failure, there will also be congestion in the right atrium, and as a result, there will be increased pressure too. Right heart failure is caused by congenital heart disease, cor pulmonale, or it can be secondary to left heart failure. However, left heart failure is much more common than right heart failure. In left heart failure, there's usually a problem in the left ventricle, and this causes a backlog of blood in the left atrium and in the lungs. Remember, in left heart failure, there's congestion of your lungs. So, the clinical presentation will reflect this. Symptoms of left heart failure include coughing up pink frothy sputum. The congestion of the lungs basically builds up pressure and causes tiny capillaries in your lungs to burst. The blood then mixes with the sputum and gets coughed up. Dyspnea, which is difficulty breathing or shortness of breath. Orthopnea, which is difficulty breathing when laying supine, which is when you're laying flat on your back. If we look at this diagram, when you're in the standing position, the fluid pools at the base of the lungs due to gravity. But when you're laying down, the fluid spreads across the entire lung and decreases the surface area for gaseous exchange. Paroxysmal nocturnal dyspnea. Nocturnal meaning occurring at night, and dyspnea, we just mentioned, means difficulty breathing. So, in PND, a person will wake up at night from their sleep due to severe difficulty breathing. Decreased organ perfusion. This is due to the decreased output from the left side of the heart to the organs. And lastly, cardiac arrhythmias. This is a group of conditions where the heartbeat is irregular, and it's due to decreased coronary artery perfusion, and the coronary arteries, if you remember, supply the heart muscle itself. With decreased blood supply to the heart muscles, there will be death of the heart muscle cells. If the cells in the conducting system die, it will cause cardiac arrhythmias. The causes of left heart failure include systemic hypertension, as previously explained. Remember, the left ventricle has to work harder to pump blood against the high pressure in the systemic circulation. Endocarditis, myocarditis. Valve failure. This will be explained in more detail in a later video. myocardial infarction, which is basically the death of the heart muscle cells, and this will also be explained in more detail in a later video. Cardiomyopathy and high output states such as anemia and pregnancy. And that concludes this video on cardiac failure. Thank you so much for watching. Please make sure you do the quiz on cardiac pathologies. The link will be in the description below.